online, as well as members and officers in room 5 in Woodhill House. So as I said, we've got one or two new faces probably around the table today, but we've also got a number of apologies. So we have apologies. Hi, Matt. We have apologies from Lee Jolly, and Angela McLeod is here to substitute for Lee from the Health and Social Care Partnership. We have apologies from Anne Aiken and Rebecca Hackett, our Scottish Government colleagues. We've got apologies from Jacqueline Lynn from Sports Scotland, from Sarah Rochester, from Aberdeenshire Council, from Kate Bond, Aberdeenshire Council, Kate Stephen, Police Scotland, and Paul Finch from Nestrans. But we have got Catherine Flavelle on the call. Catherine is the recently appointed chair of the Aberdeenshire Drug and Alcohol Partnership, and you're most welcome. And it's nice to see you here today. And we will have presenters for reports as we go through the agenda. I'd also like to welcome Professor Shantini Paranjyothi. Shantini has just been appointed as the Director for Public Health for NHS Grampian. So congratulations on your appointment, Shantini, and you're most welcome to the board meeting today, and I'm sure we'll see and hear much more of you going forward. And Councillor Stuart Adams, who's co-leader of Aberdeenshire Council, is attending today, and this will be Stuart's first meeting of the Community Planning Partnership Board. So again, you're most welcome, Stuart. So thank you very much indeed for that. And we've also had an intimation that Adam Caldwell's from NHS Grampian will probably be late and possibly not able to attend because of another event that he is attending today. So apologies from Adam if he doesn't get onto the call. So thank you very much for that. I would like to ask members, indeed, if you have any declarations of interest or statements of transparency, please, on any of the items on the agenda today. And we don't have any indications, so we have no declarations to record. I would ask you also to consider and adopt the following resolution in terms of public sector equality duty. That we have due regard to the need to eliminate discrimination, harassment and victimisation, to advance equality of opportunity between those who have protected characteristics and persons who do not share protected characteristics, and foster good relations between those who share a protected characteristic and those who do not share it. And where there's an integrated impact assessment, to ensure that you consider the contents and take those into account when reaching a decision. Can we agree that duty, please? Take silence as an agreement. Thank you very much. Item 4 on our agenda is the appointment of Vice Chair of the Community Planning Partnership Board. And if Adam was here with us today, I would be taking the opportunity to thank Adam for his contribution and participation in community planning and indeed in this board in his role as Vice Chair. But Adam, as you probably will be aware, is retiring and is moving on from NHS Grampian, and this would be his last partnership board meeting. So I would have taken the opportunity to thank him in person, but we will drop him a note on behalf of the board and wish him well in his retirement. And I believe he's going to be cycling most days, I believe, and taking the opportunity to get out and about on his bike. So we do wish Adam a long and happy and healthy retirement. And again, thank him for all the input he's had to this particular board, but also to partnership in general across the piece. Adam has been working in partnership with all of us for many long years, and his contributions, as I say, have always been most welcome. So can we please agree that we send a note of thanks to Adam? Having said that, the vacancy for Vice Chair is to be filled, and I would like to propose that we invite Mr. Andrew Wright from Scottish Fire and Rescue Service to take up the position of Vice Chair. And my understanding is that Andy would be very happy to take up the appointment if you are minded to support that.
Yeah, agreed. I'd support.
Great. Okay. Thank you very much indeed. So we will convey our congratulations for his appointment to Andy and look forward to working with him in the board. But Jason, as chair of the executive, do you want to make any welcoming remarks or to say anything about potential partnership and working with Andy going forward?
Well, thank you, Chair. So we had discussions in terms of community planning partnerships as a whole, and it was really recognised in terms of the contribution of Scottish Fire and Rescue Service to partnership, exactly as you described across the piece as well. So it sort of was myself taking the role of chair of the executive for Police Scotland, wanted to lean into community planning a little bit more because we were aware a lot of the heavy lifting had been done by the local authority in the last number of years. And I think Andy was very much on the same page of that with the board as well. So for me, it makes absolute sense that Andy takes up that role, and that not burden, because it's a privilege to be in these roles, but the privilege of taking that role is shared across the wider public service and statutory bodies as well. So that'd be apart from wishing my best to Andy as he takes up the new role, and I'm sure he'll be a valuable member of the board.
That's super. Thank you very much indeed, and thank you for that. That takes us then, colleagues, to item 5 on the agenda, which is the minute of the board of the 4th of June. The minute is attached. Can I ask you, please, if you can agree that that's a correct note of the meeting? I'll take silence as an agreement, but if you have any issues, can you please put your hand up and I'll bring you in? No, so that has been agreed that that is a correct minute and approved. Thank you very much. The action sheet, item 5.1, the action sheet is attached, and again, it is here for approval. But I don't know, Finlay, are you going to speak to this, or is Rob going to speak to this, please?
I can speak to it.
Thank you.
So the first item on the action sheet is the Tackling Poverty and Inequalities Members Survey. A report will be presented to this board on the 3rd of December, so that will then come off. The second item is the Tackling Poverty and Inequalities KPI and Outcomes Review. There was an update this morning. There's been a delay in delivering phase 1 and 2 iterations of the place data packs. This is due to issues around data protection impact assessments. However, the first iteration of packs was received today, and the proposals for tackling poverty and inequalities will start to be developed shortly. So that is the second. The third is Mind Your Mind, the Aberdeenshire Mental Wellbeing Campaign. This was to have a comprehensive options appraisal report that is scheduled for the March 2026 board meeting. The tackling poverty and inequalities stigma within poverty theme that was sitting with Amanda Rowe. This will be considered by the CPP Executive on the 5th of November and then subsequently submitted to this board for review on the 3rd of December. Also, the older and 16 to 19 age groups focus in relation to reduction in poverty. That will also be the same. The other items in relation to the CPP governance framework, this will be picked up through myself and Jason Carrigan, the exec chair, as there's a couple of bits and pieces that need to be done around the governance framework. However, it will not come to the board for reapproval, as it is only going to be minor changes. And that is the actions.
Okay, thank you very much. And would you notify members of the board, please, what those minor changes are and circulate the final document, Finlay, please?
I will indeed.
Thank you very much indeed. Any questions for Finlay, please? No? No questions? Okay, thank you very much. So those are noted and agreed. Thank you very much, Finlay, for that. Item 5.2 is the Board and Executive Forward Planner. This is here for noting, and it is on pages 10 and 11 of your pack. Again, quite a comprehensive list of issues that are to be looked at, and the lead role, the lead officer or the lead organisation is also included on there. Does anyone have any questions or comments on that, or any of the lead officers wish to say anything about the forward planner? No, I don't see anything there. So thank you for that very much indeed, for having that produced and circulated. That's very helpful. They can help track the work that's coming forward. Okay, thank you very much. That then takes us to item 6 on the agenda, which is verbal update from the Chair of the CPP Executive, and delighted to welcome Jason and ask you, Jason, to give us your update. Thank you.
Thank you very much, Chair. So this was it's a verbal update from the exec meeting that happened on Wednesday, the 13th of August. So the first item, or one of the first items on the agenda, was the flash report updates from the localities. It was confirmed that there's no matters requiring formal escalation to the board from those updates. However, significant community engagement is actively progressing across all Aberdeenshire localities, and Finlay gave a sort of update there on the data packs as part of the ongoing partnership place-based work. So that includes collaborative work with schools and young people, alongside coordinated efforts with partner organisations to ensure inclusive and meaningful engagement with the wider community. So again, that's aiming to align the engagement methods and meet the needs of all stakeholders there. So the data packs hopefully will be anticipated or arrive by the end of August, complete by the end of August, and that will support the development of the place plans. So concerns were raised, however, regarding the inconsistent access to financial resources for support in place plan activities such as funding for materials and venue hire. And it's noted that future flash reports should better reflect the collaborative nature of the work rather than being predominantly focused on Aberdeenshire Council work. So as I mentioned at the head of the meeting there, so police, for example, will feed into those place reports, and working with Rob as well, we're trying to make sure that we integrate our data in as full a way as possible, so we have that holistic view of what the community is looking like and what the locality and the place needs. So again, assurance was provided, the partner input has been incorporated into that process. The next item that was discussed was the budget monitoring. So for Martin, Kincardine and Mains place planning funding, it was noted that both balances were approved by the board were on track to be spent in the current fiscal year 25-26. The remaining balances are as follows. So for Martin was £4,000 and Kincardine and Mains was £13,500. But again, there was an assurance that that money would be put to good use by the end of the financial year. Luann came in and presented Putting People First 1-year progress report. Again, the work, I think most people on the board will be familiar with that work. Really progressive around patient passports and trying to streamline or make as efficient and effective the pathways and access to services as possible for the patients and service users. So she provided an update to the executive. Again, I'm sure she'll be more than willing to come and provide that update to the board if that was required as well. But it was well received by the executive. The LOIP annual report, as is later on in the agenda, was received and presented, and the recommendations of the report, as I say, were circulated on today's agenda. We had a report from Scottish Fire and Rescue and Police Scotland around breakfast clubs across Aberdeenshire. So again, the executive acknowledged the briefing and the continued work and the expanded areas that was delivered in, and how that was well received by the community as well. So it's especially within those school holidays, we're all aware of, in terms of the importance of those tackling those inequalities and access to good breakfast when kids in need are not at school. Aberdeenshire Health and Social Care Partnership advised that it was George Howie's, who was the acting health and wellbeing lead, was his final meeting as well. So he retires from service at the end of September this year. And again, we wished him well and thanked him for his contribution across the piece as well. There was a brief discussion around the workshop that took place was to take place. It happened subsequently, but the workshop on the 20th of August. So we hoped to have a 2-page brief ready for the board. Unfortunately, that wasn't quite ready in time. However, the board members should receive that in the next week, and that will summarise as best we can in 2 pages all of the really great work that happened across that workshop and delivering place-based community planning. So the next workshop is due to take place on the 12th of November. And again, I was really impressed with Dermot and Finley and the team, and how much work and ideas really got through in those 2 hours. It really flew by, and hopefully, as we move towards place planning and evolving towards 2027 as well, and potential LOIP refreshes, that will put us in a really good stead to understand how we evolve that work within our communities. So that was the verbal update. Unless anyone has any questions.
Thank you very much indeed, Jason, for that comprehensive overview, and invite members to ask any questions. No, clearly you've not left anyone with any questions. Jason, I just wonder, in terms of the putting people first, where or how do we know what outcomes there have been, and whether or not it's made a difference to people and recipients of this service? So I just wonder as well if a briefing note, perhaps. I've got John, Dr. Tomlinson here, as he's put his hand up, as chair of the IJB, and Angela from Health and Social Care, if that's something that is being briefed back through IJB and or Health and Social Care Partnership. And as far as this board's concerned, we had the presentation, the executive had the update, but how do we know that there's been any difference made? Dr. Thomas and John, please.
Yeah, thank you, Anne. Yeah, what was going through my mind was whether there was a conversation about how the putting people first supports the wider work that's going on around place-based and communities in Aberdeenshire. I think there's been conversations about the various initiatives and there being capacity around them. So joining up that capacity, but also from the point of view of communities seeing one thing coming at them rather than several different approaches. So I'd be interested if the executive explored that at all. Thanks.
Jason, please.
Yeah, so that was one of the topics of conversation, clearly, in terms of how do we weave that into the work around locality and place planning. A lot of what Luann had delivered, and to be fair, is probably early stages of I forget the name, John, you might be able to help me out in terms of the sessions that they have, the community-based sessions, where it's almost sort of drop-in sessions around that and connecting to people.
Community appointment days. Yeah.
That's the one. So how that weaves into, and that was probably the catalyst of the conversation around, well, how do we link that into the place plans and really join up those approaches, because exactly as you say, there will be a number of activities happening, but it's just ensuring that they're coordinated and almost systems mapping those to ensure those connections are made and relevant. But I think probably a briefing note, Chair, would be good in terms of, because I don't want to speak for Luann in terms of what they've achieved and the impact and things that they're delivering. I know that the community appointment days have been well attended, but the impact and the benefit of those will probably be a slower burn in terms of the realisation of the benefits. So I imagine that will be for Luann to continue to report into all interested parties.
Well, I think that's maybe something, an ask we could take back, actually, and maybe through Shantini, through public, the public health aspect, it would be good to get some data somewhere being reported in terms of how that is achieving betterment. I chaired a meeting this morning of the Gypsy Traveller subcommittee within the council, and we had a very, very good presentation from Evelyn, Dr. Gibb, and actually it was about accessing health services by the Gypsy Traveller community, and it's exceedingly difficult. So I wonder if there's lots of these things around that could be pulled together, and actually access to health services in general, but particularly more local access might be things we could pull together and try and draw one plan or one piece of work together from all of these different pieces that are out there, and just try and consolidate a bit. Shantini?
Yeah, so definitely. So I think sometimes, you know, how they are all overlapping or feeding into each other is not immediately obvious. So I think we've got lots of names for lots of different things, but actually, you know, the Gypsy Traveller work, that's based on a needs assessment. But you know, the next steps around that, to have a family health day, I think, with that group, that is very much based on the community appointment day type principles.
Yeah.
So I think, yeah, you know, it makes sense that, you know, we showcase how it's all working and what's the actual learning and how it's all coming together. So we can certainly look at how we do that.
That would be really helpful, I think, because there are lots of different plans, strategies, groups, working groups, and I think it would be really helpful to see that coming together, so that there's a one-stop shop, if you like, because it's difficult to keep a track within the community of all these different things across Aberdeenshire. So maybe that's something that Angela from Health and Social Care and John is Chair of IJB currently, and you know, public health generally, maybe it's something that we could all get together and see what we can map out and try and draw in. As I was mentioning earlier on to another meeting, you know, I'm very keen on a bonfire of plans, so we can get a very streamlined and clearly understood process for communities, which would be most beneficial. Thank you. Okay, Jason, is there anything else? I don't see any other hands. Are you content?
I'm always content. Thank you very much, Chair.
Thank you very much. So that might be something we could take as an action, Finlay, in you know, trying to draw together all the different strands of work that are going on in communities. And I'm sure our area managers would benefit from that too, when they're looking to progress place planning, or, you know, working together in places to get the biggest outcome and the benefit for communities. So that's fine. Thank you very much indeed for that. That takes us then to item 7, which is Aberdeenshire Community Justice Partnership Annual Report for 2024-25. Now, a very comprehensive report has been attached. Kathleen Mount and Dawn Leslie, I think, have come into the room. So a very comprehensive report. This has been reported through the Integrated Joint Board for Health and Social Care. But also, just to be clear, this is a prescribed format by Scottish Government, and officers and the teams have to fill in the format, the sheets, based on something that they have no say over. So, but lots of information here, lots of very good we've got scenarios and case studies, etc. So very comprehensive. So Kathleen, I will invite you just to give a very brief overview, please, and then we'll open for questions.
The microphone's just used them.
Okay, thank you, Chair. Sorry, I'm playing about with my microphone, it's not working.
That's all right, Kathleen.
Thank you for having us here today. We usually attend once a year, and so this is our 8th time that we've been to the Community Planning Partnership Board with our annual report on activity across Aberdeenshire. It is a report on collaborative activity, so it's everything the partnership and kind of all the partners that are sitting around that table have been involved in. As the Chair has said, there's a range of information in there. We are required to report on each of the national outcomes and priorities for community justice. There are kind of set points that we need to cover, and that can make the report quite lengthy. So apologies that it is so long, but hopefully you found it informative. I think overall it's been quite a positive year. I think initially kind of think that perhaps we haven't made that much progress, but when you capture it all in a report like that, you can really see that there has been a lot of progress over the years, and a lot of development in that period. And obviously room for improvement, I think, is what we would recognise at different sections within that report. There has been progress against the outcomes, but always room for improvement. And I think identified a few questions that we maybe need to answer as a partnership, and those are things that we can take forward through our new plan, which we're working on at the moment. We're using an assessment of a strategic assessment we produced a couple of years ago now, to identify future priorities, and already we're well underway with that work. So I think we've got a good idea of where we need to go. But obviously we welcome any comments and feedback and input from the board. So we would just ask if you could consider the recommendation, which is to consider and endorse the annual report on community justice in Aberdeenshire for the period, highlighting the progress that's been made collectively by the partnership. Over to you guys. Thank you.
Thank you very much, Kathleen. And I think a couple of issues which still remain quite difficult in terms of access is housing and health. Is that correct? Those are the two kind of standout issues for particularly people who are based in the community or indeed returning from custody. I think housing and health are the two main issues. Is that correct?
Yeah, I think so. I mean, in terms of access to services, they are probably the main ones. And we're doing quite a lot of work at the moment with our partners around through care planning for people coming out of prison. There's a new national service just come on board, so it's given us an opportunity to really look at that again, and look at where we can be improving our approach. Although there are ongoing challenges, I think we've mentioned within the report, and Rob will be aware that housing is becoming there's less available than there would have been previously, and that is becoming difficult for people because it can be quite late in the day before a house is allocated to someone who's coming out of prison. Due to other pressures, there's no particularly one standout issue, I don't think. And then that can have a knock-on effect in access to other services, because Aberdeenshire is such a big area. It'll be a different team picking up that support basically. It just needs a bit of planning and a bit of collaboration, which we are looking at as a partnership at the moment. Health, I think, has been one of those ones that's been an ongoing issue, I think, but probably again because of the nature of Aberdeenshire, and that there isn't, it's not the same in every area, because it's a very diverse area, and there's lots of challenges that everyone will be well versed in. I think we doesn't need me to go over them. But again, if you haven't got your house, and finding your GP and finding your drug and alcohol team can be a challenge. But yeah, it's something we're aware of, and hoping we can work together with. There's other challenges as well around the kind of wider business partners, things like trying to keep people out of prison, trying to keep people off remand, trying to work with the judiciary and the courts to promote bail supervision and other alternatives to remand, and that can be really challenging because we can have a variety of different sheriffs in our the 3 courts that cover the Aberdeenshire area, so it's not as simple fix as going to one sheriff and asking for certain approach. It's just a bit of work to be done, but we're definitely working on it.
Thank you, Kathleen. Shantini, please.
Thank you. So thank you for the comprehensive report. It's really helpful. I was just wondering, in terms of planning in terms of the next plan, how you're exploring the opportunities for I guess early intervention and prevention, but in relation to this population, particularly around continuity of care, so people leaving prison who also have mental health and substance use issues, how to what extent the plan could potentially support with continuity of care, using things like the liberated method. I think they use the phrase sticky person, but it really is about continuity of care and having support really to improve outcomes.
Yeah, and I've had have been in the fortunate position of supporting the health centres within HMP Grampian, and one of the priority areas has been that liberation pathway. Now, continuity of care, absolutely, that's essential, but there is something about the transition from community into custody as well. So that information around about existing treatment, existing unmet need, identification of where somebody hasn't been able to access services in the community for substance use, mental health, primary care issues. If that information comes in to custody with that person, and we have had some stumbling blocks around about information sharing, about the speed with which that communication can come in with that person, then I see custody. There's lots of reasons for people being in custody, but it is also an opportunity for a lot of that whole person approach to be put into place, and certainly access to health services that is meaningful, that can then be put into place, and then, as you say, continuity of care. It's as good as a small amount of input whilst in custody, and hopefully we're reducing short-term sentences. But that, for it to be effective, it needs to be part and parcel of that care when somebody comes out of prison. So certainly within HMP Grampian, that's been a huge focus and a priority, and there are challenges because obviously we have, to be aware of the rising prison population, so we have less opportunity maybe in other establishments. People are moved around frequently, so that transfer information sometimes can be tricky just in terms of logistics and coordination of that. So at the point of them being liberated, then that continuation of care is more challenging. That said, there's no there's no halt in trying to resolve that. We have prioritized through care planning, and certainly within our own partnership, but nationally it is absolutely like being pushed, and quite rightly so. Absolutely, and that early intervention, prevention again. For people in custody, yeah, there is a huge work stream around about that, and colleagues in public health are very visible within certainly the custodial environments in terms of that prevention agenda, and it's just about giving opportunities for people to learn how to take care of themselves, learn how to access health services, and to get into a good regime, be that oral health, be that sexual health, be that attending for vaccines. All of that is again a priority area, certainly in HMP Grampian Health Centre, and I'm sure modelled across the other health centres within custody. Within the community, it is more challenging, as Kathleen said. We have a very large area that we cover, but absolutely looking for continued dialogue with our partners in health, so that early intervention, improvement to access services within the community is remains one of the good examples of community justice partnership working.
Thank you, Dawn. Shantini, do you want to come back? You happy? Okay, I don't see any other indications. Oh, Rob?
Yeah, I think one of the challenges you touched on around staffing, particularly in justice social work, is that due to restrictions or inability to recruit, and is that something that you see impacts across partners as well? And what are the, I suppose, longer term implications of that piece?
Okay, thank you. Kathleen, is it?
We are so fortunate in justice that we have never fallen short of applicants for posts. I think the challenge were the restrictions and the new processes which result in delays, and again, budget wise, we are ring fenced. We have we need to spend a penny to gain a penny. If we go over that, then that's not okay. We have no other means to manage that. So our ring fence nature of our budget, I would say just took longer than we would have anticipated to just have that assurance, give that assurance that when we're asking for numerous posts, and certainly against annual allocations of funding, that understandably raise questions around about the number of posts and the frequency of the ask. That built in delay, so it meant that obviously for up to about 6 months, we were not getting posts through. But, you know, that has been resolved, and yeah, our budget is very clear, and you know, senior management within the health and social care partnership and indeed in corporate vacancy and processes have a clear understanding, and we're very transparent about, you know, how we allocate funding and what we require in terms of our workforce, which is very specific, it's laid out in our funding marker. So it does need it. I mean, I take responsibility for not being as clear as I should have been, and I presume to everybody would accept our position, but I needed to give a bit more of an explanation. The impact was really in staffing some of our services, but that has been resolved.
So if I may, Chair, just come back.
Yes.
So that, yeah, so it's not an ongoing issue, and it's
No.
not something
No.
that is impacting on service delivery at the other end of it. That's
Not now.
a
Yeah.
block that was there that's been dealt with.
Absolutely. Yeah. That's,
I can maybe update the report to reflect that. I think
yeah.
it's because we're almost kind of 6 months behind with this report. It is talking about issues that were there during 24-25. So I can certainly add in it's now been resolved just to clarify for kind of future.
Yeah, I think that would be helpful.
Okay, Rob?
Yes, thank you.
Okay, thank you very much. In the absence of any other hands, I wonder, Jason, is this a topic which you would wish to perhaps take back to the executive, the community justice agenda, and perhaps have further discussions with the partnership, the community justice partnership? I think Kathleen said right at the start, we see each other annually, but I just wonder if there's anything, you know, within the agenda and within this annual report, and perhaps planning for the future. I mean, Shantini mentioned that as well, that the executive might want to take an interest in.
Thanks, Chair. Absolutely. So I sit on the Community Justice Board now. I sort of recognise the same observations that you have there. So we've got that cross-pollination. I'll be able to take back, as well as George Nixon, who's my Chief Inspector, who sits on it as the official police rep. I'll sit on it as Chair of the Exec as well. So that cross-pollination is happening, and obviously Dawn and Leslie and Kathleen are always welcome to come to the Executive. And you do.
But I think if we can leave that with you, and perhaps, you know, some of these, you know, issues that like access to appropriate housing and the health issues that both Shantini and Dawn and Kathleen have raised, just to continue that dialogue and to get in underneath some of the other aspects of community justice. You know, are we reducing reoffending year on year? And, you know, Dawn and I have history around Northern Community Justice Authority, and which was a very successful authority, I believe. And well, I would say that, wouldn't I? But I do believe that we had far closer connections, if you like, in terms of understanding each other's agendas. So I do think that perhaps if the executive took an interest in the community justice side of things, and perhaps brought forward any recommendations that you might have for us to consider, if there are any, that would be really helpful.
So, sorry, Chair, just very quickly on that. We had a really good conversation around employability and training at the last board, Community Justice Board, and that's something that we're taking with economic development within the community planning, for example. So that will take place. We'll update the board as and when those conversations and developments happen.
I think that would be really helpful, and it'd be good to get a closer working relationship with the Dawn, Kathleen and colleagues. So thank you very much indeed for that, Jason. That'd be really helpful. Okay, thank you very much indeed. So Kathleen did refer to the recommendations on the paper before us. Can we agree that, please? And thank you both very much indeed for coming along and for all the work that you and the teams do. It really is appreciated. Thank you. Thank you very much. That takes us then to item 8 on the agenda, which is the Alcohol and Drug Partnership Annual Report, which is attached on page 96 in your pack. And again, I'm really pleased to welcome Catherine, the chair of the ADP, and you're most welcome, Catherine, and please, you'd like to introduce your report. Thank you.
Thanks very much, Chair. It's really good to be here to meet you all. I'm relatively new in post. I've been with the ADP since the beginning of March. And although that might seem like quite a long time, I'm only contracted to work 3 days a month. So my actual time in post is actually quite small. So it's been quite a learning curve for me. But I'm pleased to say that there's been some, I've been some really good changes, and sort of dragging up the ADP, sort of sorting out some inconsistencies and having a look at, where the problems are and trying to make us generally a more efficient, more collaborative partnership. So we've one of the things was I felt that the list of partners, there were some gaps, there were some redundancies in there. So we've had a review of the partnership agreement, we've had a review of the actual partners, and we've now invited Tackling Poverty and Inequalities. We've got Child Protection Committee, the Youth Thematic Group, representation from GERFEC, also Violence Against Women. These were all gaps we didn't have in our partnership, which we've now included. And obviously our sort of long-term partners, the prison service, the community justice and the police and public health, are still contributing greatly. In terms of our strategy, our current strategy finishes this year. Being Human, it was called, and we are about to start writing a new strategy, but we're waiting on the Scottish Government giving us a new delivery framework for ADPs in early 26, so that will be incorporated. We're going to take a collaborative approach and actually invite all partners to contribute to the new strategy, so we're quite looking forward to workshops on that. With the ADP, there's always constant changes in priorities and local trends and the various populations. Of course, we have a rural shire, so it does lead to challenges, but that means we're constantly looking at development of services to sort of fill those gaps. And what I want to highlight is that lived and living experience, which is one of our main subgroups, is actually at the heart of everything in the alcohol and drug partnership. Because we have to use that lived experience to inform our services and give us the feedback we need to show what we're doing well, what we're not doing well, where we can improve. We've had a new experiential officer with us since the beginning of this year, and she's been absolutely amazing, Amanda Stephen. She's doing so much engagement with communities. She's increased the engagement, more than 200%, and getting all that feedback is absolutely amazing. We've also got one new and other improved step-in centres across 5 locations now across the Shire. They're in Stonehaven, Banff, Peterhead, Fraserburgh and Inverurie. And these are fantastic places where people can get immediate access to support treatment, including psych services and social work. We have ADA there, and also there's a nurse on site to help with any assessment needs that we have. A lot of the clients come from referrals, maybe through GPs or other services, but we also, it is a step in. People can just walk up, and one of the things we need to be working on is actually getting signposting better so people know those places are there, and it just gives much better and earlier access to support. We also fund residential rehab. We have rehab places, and these are funded by the ADP. And again, that we're looking to work better with our partners to ensure that those are used well. Family support is obviously a priority, and ADP funds SFAD, which is supporting families and people affected by drugs and alcohol. So yeah, just want to briefly touch on the annual survey. The annual survey is a document is a template document that we have to produce for the government every year to show what we're doing against the various priorities. And if you've had a look through it, it's a quite dry document with lots of X's and but you can see that we are doing well in many areas. We have a green rating for all the MAT standards. If I'm confusing you with acronyms here, I had the same. So MAT is the medically assisted treatment standards. which are quite a key priority for the government. That's the, you know, how we treat people who need medical help with their addictions. But there are gaps that have been identified. One of them is dealing with drug and alcohol harms, and we're actually now developing a new subgroup of the ADP, which will deal specifically with drug and alcohol harms, including death reviews, harms reviews, analysing data, sharing information on new concerns. There are a lot of new concerns in the substance abuse arena, including the rise of ketamine use and also synthetic substances being mixed in to drugs that are causing real health concerns, such as nitazines, which are, you know, are quite dangerous. There was an identified gap in peer support, but again, our new experiential lead has already been developing conversation cafes, much greater engagement, and lived and living experience steering group. Stigma training, I know this is a big thing in the tackling poverty and inequalities as well. Stigma is obviously a huge issue for people, drug and alcohol users, and we are doing training for many workers who work in the service, and also have developed a Charter of Rights for users. However, the biggest gap in the annual survey was the youth engagement and services. This was one of the key things that made me look at the partnership members and see that we really didn't have enough representative from children's and education services. So there's already work starting in schools through the police and the youth thematic group. A lot of focus also on criminal exploitation of children, including identification of vulnerable young people, county lines, etc. And early intervention and prevention is something we're going to be focusing on as well. A mapping exercise, which is something I have been pushing for. We haven't done one in 5 years, but we really need to know what actually goes on in all of our academies in terms of education and services for young people, you know, to keep them informed about drugs and alcohol dangers. So I'm keen to ensure that all schools have some access to advice and support, and also signposting, which is vital. We don't actually have any accessible services specifically for young drug users. So that's something we want to look into, how we can address that. We do, though, have plenty of support for children affected by drug and alcohol users through our family support, Libra in particular. So those are the main areas of improvement and the sort of challenges. And thank you for listening to me ramble. And I'm happy to answer any questions if I can.
Thank you very much. Certainly not a ramble, and just giving us a very comprehensive overview of the time spent since you've come into the board, Catherine. And you know, for somebody who's contracted 3 days a month, a huge amount of work has gone on, and I'm sure that you're not sticking to your contract hours. So but aware very much so of all the work that Claire and Amanda and the teams have been doing,
yeah, fantastic.
as well. So collectively, I'd just like to offer thanks and congratulations on the work that you've done to date. Clearly an awful lot more on your agenda going forward. So that really is appreciated. And again, the information in the report, very much appreciated, and it gives us a very good a view of what you're about. So thank you for that. John, please.
Yeah, just first to echo that, thank you, Catherine, for coming along and giving us the report and the overview. Yeah, it jumps out the bit about the top slice money, and that's 31% of that chunk, and therefore that's a lot of resource that might be applied differently. And I appreciate paragraph 319, you're talking about a meeting to understand it. So maybe this question comes once you've had that meeting, but it would be useful to just us to understand it as well. And is it something that happens to all of the ADPs in Grampian?
Thanks, John. I'm really glad you asked that question. I wasn't sure whether to bring it up because it is a huge issue for us at the moment. But for those of you who don't know, we get our funding from Scottish Government, but we have this top slice that's been historically taken off for many years to the NHS, and there's been questions for a long time of what it's exactly for. I think it started in 2006, and there just seems to be very little evidence of what's happening to it. Now, I think there's been some work, and we've identified certain areas that it goes to within the NHS, but there's about 1.3 million still unaccounted for that nobody seems to know what's happening. Now, NHS Grampian are the only area that does actually have this top slice taken out of the ADP. So this is one of the reasons why we're looking into it to find out what exactly is happening. Lee Jolly has been fantastic and like a dog with a bone with this, and she's working hard to try and get to the bottom of it. So we did have a meeting last week, and with the other ADPs in Grampian, and because it's to say we're all affected, although Aberdeenshire has the biggest amount taken off of their budget, because it really would be such a huge resource. Now, it might be that money is being used in drug and alcohol services within the NHS, which is perfectly valid, and but at the end of the day, this is public money given to us by the government for a certain thing. We need to know that 1.3 million that is sort of nobody seems to know what it's for. So we've sort of asked for a deep dive into that to see what it's being used for, because at the end of the day, we need to account for it on our finance sheet apart from anything else. So, and if it is turned out that nobody really knows, then hopefully we can pull it back in to the ADP and use it to fund some of these other services that we desperately need.
John, would you like to come back?
No, I'd just like to understand it once the information is available. Thank you.
Okay, we'll make sure we'll clue you in, Jim, when we get the full information.
No, that's really helpful. Thank you. Chief Executive, Jim, please.
Thanks, Catherine. Good to see you again. Hello. Thank you for. We spoke about this matter a bit when we met. For me, I think it's an important area to pursue, as Catherine set out, which it may well be that these are funding which is being directly applied by NHS colleagues in the pursuit of our work in terms of the software prevention, in terms of alcohol and drug use. There is a question here about it ought to be something, as I would see it, for the ADP to be the commissioning body for all uses of that funding. And if that may well be, then that is NHS Grampian providing services, but it's got to be on a provider basis who has been commissioned in that respect. So I wonder whether it's twofold actions here. One is to identify the utilisation of it, but secondly is to, is a point of principle, is to alter the relationship between the ADP and other partners and the funding flow to make sure it goes through the commissioning body. Thank you.
Yeah. Can I come back at that? That's so fantastic to hear you say that, Jim, because I tried to explain that this is how I thought it should be to the group at the meeting last week, but I don't think I put it over very well, and people looked a bit confused. But to me, even whether we need to provide that money to the NHS, it shouldn't be taken as a top slice just off the top. As you said, it needs to be us that administers those funds so that it actually is on our budget sheet saying this is what we pay to here. And to me, it just seems to be a very, up till now, up till we've started looking into a bit of a cloak and dagger situation that seems a bit suspicious. But hopefully we'll get to the bottom of it soon.
Yeah, thank you both for that. Just for others' information, with a different hat on, my John and I met with Catherine and some of her colleagues to discuss this very matter some weeks ago, and certainly we're all very supportive of that investigation, if you like, going forward. And I'm glad that you are beginning to progress some of the conversations. And I know that Lee is particularly keen to make sure that is bottomed out. So, but I think Jim's approach or Jim's articulation of the situation is extremely helpful, and that if there's anything this partnership can do to support that position, we'd be happy to do so. And perhaps, Jason, that's another aspect of work that you might want to think about taking through executive, just to make sure that the ADP, that we are cited on the ADP and the ADP are cited on us. And if there's anything this partnership board can do to support any of the work, then be very happy to do so.
Thanks, Chair. Just again, not to preempt you, but Catherine has rejoined the exec and have that dialogue.
No,
Yep.
that's fine. Very helpful.
Brilliant.
Thank you very much. So, colleagues, the recommendations are on page 96 to consider and comment on the ADP annual report submitted to Scottish Government as detailed in the report, and acknowledge the ongoing efforts to strengthen governance and organisational structures within the Alcohol and Drug Partnership. And we absolutely do that. And, you know, as I say, if there is anything we can do as a partnership to support that, then be most happy to do so. And perhaps Finlay, you could just take a note in the minute that we have recognised the funding issue and would be very happy to support ADP going forward and with anything we can do at all to make sure that the commissioning element of the service is actually put in place.
Fantastic. Thank you so much, everyone.
No, thank you, Catherine, and it's lovely to see you here. So we'll look forward to meeting with you again shortly. So thank you for that. Colleagues, the next item on the agenda is the LOIP annual report, which has been attached. This has been round various committees within the council and I'm sure other partner organisations. And I'll just ask Jason if you can give us a very brief overview on the report, please, and then we'll move to recommendations. Thank you.
Thanks, Chair. Again, I don't propose to principally go through the report. Hopefully everyone has read it. There are certain highlights in there in terms of the good work and some of the progress still to be made as well. So again, the key achievements are highlighted on page 155, item 9.1 there, in terms of the households that have been supported to increase household incomes, for example. Some of the connect work, the local employability partnerships there as well. Information advice services within Aberdeenshire, increased household income across there as well, tackling those inequalities, and also, you know, right through the title contents page, you can see some of the real great work that's happening. Obviously the place-based work now sort of comes to the fore and how we're delivering within our communities. But short of questions being asked, I wasn't going to go into any much more detail than that, Chair.
No, thank you very much. But you have mentioned, and I think it's worth emphasising, actually this report shows such a lot of good work and outcomes that are being achieved. And I think sometimes we're quite hard on ourselves and we always want to do more and do better, which is a good thing. Continuous improvement's always good. But I think it demonstrates the work and the real partnership and the real benefit of partnership across the piece, and it's how we actually focus down on the most important issues and go forward on that basis. I think is really worth acknowledging, and on behalf of this board, certainly thanks to everyone within all of our organisations that are represented here and beyond, for working together to make sure that we've got an annual report that is so positive in so many ways. So thank you all very much indeed. And thanks to the work the executive have done as well in steering us through this particular programme. So thank you. Any questions or comments, colleagues? I don't see any indications, Jason. So again, recommendations and, oh, sorry, Glenn, thank you.
Sorry, I was in a bit late.
No, you're fine.
It's just to pick up very much echoing your own sentiments and the tone that there's an awful lot of really good work here. Mm-hmm. And I think that you'll remember, Anne, that this was mentioned at Communities Committee. I mean, communicating that good work and the outcomes would be useful, I think, not least amongst elected members, I have to say, being quite parochial about it, because I think that it's not as known and as appreciated as much as it should be. And I think you're right, Anne, in terms of being hard on ourselves sometimes, but this is something that should be trumpeted a lot better through communications, I think.
No, thank you for that, Glenn. And that's certainly something that we can take forward in terms of how we report this annual report. So it will be published on the website. But of course, I do think that perhaps, Finlay, there's an action in there just based on what Councillor Reynolds has said about perhaps communicating across the 6 areas of Aberdeenshire. Just reporting back and communicating that success, I think, would be really helpful, and just letting members know. I mean, every member or all members should have seen this in any case, because it was on the committee reports, and it was open to everyone to view. So, but I do think that we could perhaps communicate the successes, and perhaps with Jason Finlay, you could work with Sarah and get a news release together. And perhaps tailor it for particular aspects of work if they're more relevant in one area or another. I think that would be really, really helpful. Thank you for that. John, please.
Yeah, tell me if this is not the right time to raise it, because this is about the report itself. So totally welcome and thank everybody for the work and what's presented there. It was just reading through it, one bit in particular kind of jumped out at me. That's page 174, where it's about the unemployment rate for 16 to 19-year-olds. And I'm just conscious of the that kind of doubling, although the overall numbers is 300, I think, or thereby. Whether there's a trend there for the future, and if that's going to be adequately picked up through the tackling poverty strand or not. It's just that jumped out as I scanned it, and so I just thought I'd kind of highlight that and ask the question.
Jason, is that something that you've got an eye on?
It's something we can definitely explore. Maybe if we take an action, Chair, and come back for a response to John.
Okay, that would be very helpful. Thank you, John. One last call for any hands. I don't see anything. So the recommendations are on page 148 to consider and comment on and approve the draft annual report, and it will be published on the website. Note that it's been considered by the executive, and Jason has reported back on that. And note the draft annual report has been considered by the Council's Communities Committee, and Glenn has picked up the salient point from that. And with that action, Finlay, to come back with perhaps more information about the unemployment rate would be really helpful as well. So can we agree those recommendations, please? And again, thank everyone involved for all the work that goes in. And I do think Councillor Reynolds, Glenn's absolutely right. We should be making sure that we're sharing that. Thank you, Finlay. Sharing that publicly. Okay, colleagues, that takes us to item 10, which is the date of next meeting, which is the 3rd of December. I can't believe that. On Wednesday, the 3rd of December from 2 to 4:30. So that will be in, oh, sorry, Nicola, yes, you've just come in. I just noticed that. Yeah, thank you. Your presence will be, your attendance will be noted. So thank you for that. And that will be in Woodhill House and or online. So thank you all very much in the meantime for your attendance and participation. Thank you all to the authors of the reports, and thank you to the executive as well for steering us through a lot of this work. So many thanks everyone, and we'll see you again in this forum in December. Thanks all very much.
Thank you.
Thank you.